Good afternoon. My name is Frank Haney. I'm the Winnebago County Board Chairman, and I am joined by Rockford Mayor Tom McNamara and Dr. Sandra Martell, Public Health Administrator for Winnebago County. Thanks again for joining us today. The state reported about an hour ago 1,140 new COVID cases for a total of 25,733. The 25,000 plus compared to less than 100 on March 18th. I heard an interesting story lately about a hospital situation in the state where the doctors and nurses worked very hard with a patient that was struggling greatly, and through their efforts and the fight in the patient actually wound up going off a ventilator, out of ICU, and is making on a road to recovery. We've seen similar stories like that in social media throughout the country. When I heard that story, my mood changed. What's the rub? Is if we're going to have patients fighting and we're going to have frontline healthcare workers and first responders fighting, then the rest of us need to continue to be up for the fight as well. Today I want to center my remarks around another group that is in a bit of a fight through this COVID epidemic or pandemic and all that it includes, and that is our small business owners in our community. Myself and many others have been very vocal proponents of residents staying at home and adhering to social distancing in March and April. It is clear these efforts have helped bend the curve, slow the spread of COVID-19, and I believe save lives. For that, thank you very much for your continued commitment. Social distancing, wearing masks, and washing our hands, it works. It's proven to work, and it will continue to work if we stay committed to it. It is science. The experts were right in this regard. We should continue to listen to their guidance as the governor's order comes to an end on April 30th, 2020. Unfortunately, early May is also a time when we are expected to hit our peak, unless something greatly changes, of COVID cases in Winnebago County. That's what folks are suggesting the modeling is telling us. It is important that we don't get a false sense of security because models are being adjusted down to reflect the success of our citizens' commitment to social distancing. We have learned this, is that the virus spreads quickly, it hits hard, and that a second wave will be larger than expected if we don't apply these principles going forward. As a layman, people always ask, when will this be over? The best answer I've heard is when there's a vaccine, which could be over 12, maybe even 18 months away. That's to be determined, but it's not anytime soon. This is not the beginning of the end of the COVID-19 response, but perhaps sometime in early to mid-May, it may be the end of the beginning of the response. A public health crisis by itself is extremely challenging, and this one may be one of the most challenging that we've ever seen. But a public health crisis coupled with an economic crisis is even much more difficult. To that end, there are more than 22 million Americans have become unemployed over the last 6 weeks. As we mentioned before, 513,000 Illinoisans filed unemployment between early March and April 5th. That being a 400% increase over that 5-week period that began the Great Recession. A recent study showed a large percentage of of small business owners are concerned to some degree about their survival over the next year and a half. I do not need to tell you how hard the hit has been in Winnebago County. You see it with your own eyes. You hear the stories with your own ears. The video of the Charles Street shoe shop owner and his mother talking about how hard it has been on their business and their family brought many of us to tears. Their story is the story of many small business owners in the Rockford region. Just as COVID-19 impacts our health in inconsistent ways, some more harshly than others, it has done the same on the financial side as well. To be clear, the governor was right to take decisive action around COVID-19 mitigation in mid-March. I believe it saved lives. Inaction would have cost lives, and we'd be in a much worse situation right now. However, it is also clear that I believe anyway, that there is a little bit of inequity between big box stores and small business in the order itself. And as we go forward and we work to perfect or adjust things as we go forward, not just in May, but in several months ahead of us, maybe we could take a look at that and adjust it to the realities of our current and new environment. It certainly could be reevaluated. Economic leaders like public health and healthcare leaders share their expert opinions in their respective areas of expertise. They all have solutions that are easier to implement when you do not have complicating factors such as the other. So for the public health folks, we're working on things through a tough economic time and vice versa. Unfortunately, we don't have the luxury given that this is a two-front war. And although we all agree that the biggest threat to the economy are major surges of COVID-19 cases, we need to adjust our strategy at some point in May or in the early part of the summer. Social distancing 2.0, for lack of a better term, would allow small business perhaps to reopen at some level that's responsible and still strictly adhere to social distancing principles that we know work. Unless things change greatly, it may not be responsible or prudent to just 100% restart all business May 1. And I know that is being talked about. It does not make sense from where I'm sitting. It has been said that the right balance may not be about flipping the switch on the economy as much as it's about adjusting the light dimmer where we phase in changes over time. And we balance the need to reopen our economy very closely tied and aligned with public health of our community. Social distancing is going to be a way of life, I believe, for the rest of 2020. The science of social distancing will work in a small business if we are vigilant and committed, and if we work with our healthcare professionals to make sure we do it right. And vigilance is key, because here's something we're also not talking about. Consumers will not return to normal shopping habits if they do not feel safe. So let's adjust our strategy where we can, continue to strictly adhere to the principles that we know that work with social distancing, and evaluate as we go and as we move forward together. Progress is the goal, even if it is not perfect. I have respectfully relayed my thoughts to the governor's office, as many other community leaders, including Mayor McNamara and other mayors as well, have done that. I do want to take this opportunity to thank the community for their commitment, and together again we will get through all of this and come out on the other side.